Hello friends, today we will be going to talk about tuberculosis in children, and I will also talk about various questions you had about tuberculosis. So the first question is, when should we suspect tuberculosis in a children? So any child with history of fever or cough which is lasting more than 2 weeks, that is 14 days. If fever and cough is more than 14 days, we should suspect tuberculosis. Second thing is, if your child is not gaining weight from last 3 months or there is a weight loss of more than 5%, then also we should suspect tuberculosis in your child. Your child will be lethargic during this period, your child will not be interested to the surrounding, and there will be severe loss of appetite. Apart from this, there are other types of tuberculosis also, lymph node tuberculosis and neurotuberculosis. In lymph node tuberculosis, what happened? There are painless large swelling around the neck, axilla, inguinal area or over the chest. That may be a sign of tuberculosis in children. The cough in tuberculosis is usually productive. That means it is associated with sputum. But occasionally in older children, sputum may be blood tinged. And what are the symptoms of neurotuberculosis? If the child has a history of confusion, nausea, vomiting, or the child is very irritable, very lethargic, and there is gradual and progressive deterioration in the school performance, and there is history of sudden unconsciousness, then we may think about brain tuberculosis. So these are the common symptoms of tuberculosis in children. The second question is, if a child come in contact with a person with tuberculosis, will all the children will develop TB or not? The answer to this question is, everyone suffering from TB infections, any child who is exposed to a person with TB will not have tuberculosis or not have the disease. The child may get infected, but the child may not manifest it as a disease. The third question is, it may happen that you may heard that someone have developed tuberculosis in the school. Some child have tuberculosis, or your child's friend is suffering from tuberculosis and your child is had played with that child. So in that case, how will you know that whether your child is suffering from tuberculosis or not? So basically, what are the diagnostic modalities available to diagnose tuberculosis? So the answer is, any child who has TB symptoms or history of exposed to a TB patient or a TB child, the first thing is we can do a chest X-ray, which is act as an initial screening test. If the X-ray is abnormal, then we can do further testing on the sputum. And when a child is not able to cough up the sputum, if the child is not able to cough the sputum, which usually happen, then we can prescribe some medication to induce the sputum and do test on this induced sputum. And or in the worst scenario, if the induced sputum is also not available, then we can test the swallowed sputum by putting a nasogastric tube and taking out the gastric aspirate. The gastric aspirate should be fasting after fasting overnight for at least 4 to 6 hours. And sometimes TB can also be diagnosed from a site where there is pus or there is fluid in the lung covering, which is known as pleural fluid. So establishing the diagnosis of TB is very important and require very high skills and expertise. Therefore, it is always important, if you are suspecting that your child has come in contact with someone with tuberculosis, then you should immediately visit the doctor and do all the tests. And it is very important to have a diagnosis to start the treatment of tuberculosis. Another question come to the mind of the parents is it curable? Is TB curable? And how it is treated and how many months of treatment is required for complete cure? So the answer to this is, tuberculosis can be successfully treated in most of the cases. The treatment of TB is possible and freely available in our country at public health facilities. The most common form of TB, which is the lung TB, can be treated by oral medicine given for a minimum of 6 months. There is a slight change in the therapy regimen nowadays, so you should take consultation of the doctor to have the proper doses. If the child is having TB of the brain or bone, then one need to take the treatment for at least 12 months. And it usually takes few days to 4 weeks for the patient to feel better after treatment. However, the treatment must be taken even after the symptoms disappear and you have to complete the course of the treatment. If you don't complete, there may be chances of recurrence. Another common problem faced by parents during the treatment of tuberculosis is that the medicines have very bad smell or not palatable, and the children are not able to take the medicine, feel vomiting. So in that case, what you can do? So it is not unusual for some children to have an averse to the smell or taste of medicines. However, TB is a serious illness and prompt and complete medication is mandatory. So what you can do is you can try to mask the taste or site of the drug by mixing it with any sugary syrup or a teaspoonful of jam. Most TB drugs are available as flavored dispersible tablets, which can be easily dissolved in water and given to the children. Some other important things which questions that often parents ask are, is there any special diet for a child suffering from tuberculosis? How many days the child will not be able to go to the school? Should they use separate utensils for the child, or whether they can share the bed with other children or other sibling at home? So it is advisable to give locally available nutrient rich or fortified supplementary food to the child. If the child has a loss of weight and not regaining the weight back by 2 months, it is better to get an expert opinion, and if required, the child may need to have some micronutrient and macronutrient supplementation along with fat and protein supplementation. A sick or a coughing child should not be sent to the school, otherwise what will happen, the child may transmit the infection to others. Sharing of food or utensil does not increase the risk of transmission, and sharing of beds as far as feasible should be avoided during the symptomatic phase. And last important thing is, if your child is suffering from tuberculosis, you should know how frequently you should go to the hospital and check your baby. Usually your doctor may see you after 2 weeks of starting the treatment to see all is going well or not, and then at 2 months of therapy, as that is the time to reassess and change of the treatment protocol from 4 drugs to 3 drugs. Therefore, you may see your doctor every 2 months till he decides to stop the treatment. Apart from this, you may need to consult the doctor if the symptoms do not get better or get worse after starting the treatment, or there is appearance of new symptoms or adverse effects like nausea, vomiting, anorexia, because there may be side effects of medicines. There may be joint swelling, visual disturbances, etc. So you need to complete the course of medication, the prescribed duration of time as advised by the doctor, and stay in follow-up with the doctor every 3 to 6 months for about 1 year. So with this, I am concluding this video. If you find this video helpful, then please subscribe to this channel, and for more informative videos like this regarding child health, you can follow me. Thank you so much.